Are we trying to figure out these back here?
No, I don't know about that. I just know
No, I
the,
think this row.
yeah. Well, there's a thing up here, there's a switch.
Here we go, here we go. Ah, well done.
You got it? Okay.
Good evening, everybody. I will call our City Council meeting to order of March 18th, 2020. If everyone can please stand and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. The first item on our agenda is the approval of the agenda.
So moved.
Second.
All in favor?
Aye.
The agenda has been approved. The next item on our agenda is a resolution enacted pursuant to Minnesota Statute Section 12.29, extending the period of a mayor-declared local emergency. A resolution enacted I just shared that. In the executive summary, it says, due to the evolving COVID-19 pandemic that is impacting our local community, state, and country, Mayor Regan Gonzalez, myself, has declared a state of local emergency and calls upon the City Council to extend the declared local emergency in order to protect the health, safety, and welfare of the city and the community. I wanted to ask before we move the recommendation, is there any staff updates on this declaration? Or maybe we can just explain to the audience what it means and what it allows.
Sure, Mayor. So your declaration of the local emergency allows the staff to have flexibility in our spending. And I can just give you a few examples. So right now I sign off on things that are $1,000 or more, but I've been pretty busy. And so I would be able to delegate that to Chris so that he could sign off on anything, say from $1,000 to $5,000. It would also give us the flexibility to approve things electronically. You know, right now the virus does get on paper, and so we are looking at ways to eliminate doing things by paper. Those are some of the things that we may be able to do. We should still be able to provide you the information like we do now on all the claims and payroll, and we are going to be able to have meetings by telephone, which I know you're going to announce tonight. And so you should be able to have the approval process that you have now. As things evolve, we may have to modify that as well, but it doesn't look like that will be in the immediate future. Does that give you further information?
Absolutely. Thank you, City Manager. Oh, and our City Attorney, Mary Teachin.
Yeah, Mayor and City Council, if I could just elaborate on that a bit. In addition to the spending flexibility that City Manager just mentioned, you know, there are certain requirements with respect to competitive bidding and that kinds of things for purchase of certain supplies. And under a declared local emergency, cities are exempt from those procedures, so it just provides for a quicker, more efficient way to purchase necessary equipment and supplies if that becomes necessary. And also, and perhaps the chief and Jennifer can address this further too, but there are a myriad of other things that could come into play too with respect to a local emergency. For example, reimbursement of certain items from FEMA, for example, or triggering mutual aid agreements, that kind of thing. And we're trying to just cover the gamut here and make sure that the city is protected with respect to all of those things. And so the declaration can potentially help assist with a variety of other issues as well.
Thank you very much. Councilmember Supple.
So I'll move to adopt the resolution extending the mayor-declared local emergency.
Second.
Any council questions or comments, discussion? Councilmember Supple.
I just wanted to thank the staff because I know you guys have been working morning, noon, and night, and we really do appreciate it. Thank you.
Absolutely. Do you have Councilmember Troutman?
Thank you, Mayor. Just like Councilmember Supple mentioned, we know not just the hours, but the incredible the incredible pressure that you guys are under and how you're responding. You're redoing so many of your processes. Simple things have become more complicated for the moment, and I'm just so grateful. I just want to say on behalf of all our citizens, I wish I could say it more, and I wish we could hug. Because I just am deeply, deeply appreciative of all our staff, but especially our law enforcement and our firefighters who are on the front lines. And I appreciate the very particular circumstances that that you guys are standing in when their health situations and their public safety situations. You guys are continuing to answer that call, so appreciate that. I also want to. I have a comment about a friendly amendment that I want to offer, but I also want to just thank our mayor too, and we're just incredibly grateful. A lot of people might not know this, but your background is in public health, which of course is very timely. So we appreciate your leadership and are glad for that.
Thank you.
I had a chance to chat with our city attorney, and I did have a question about the timing of the emergency declaration and just making sure that the council, and I don't have there's zero reasons to think that this would ever be an issue, but that we would create some kind of fail-safe method that would allow the council to revisit the emergency status and have a vote on that at some future date. Because right now, as I understand the law, that we would make a declaration and it would have to be put on the agenda, but we would have the opportunity to put that on the agenda for maybe 6 months down the road. So that would create a date certain that we would revisit, and hopefully this is behind us in 6 months. But if it wasn't behind us, the council would agree at this point to at least revisit it at that 6 month period. So if I'm 100% sure this motion will pass, but I would offer a friendly, would it be amendment or be a second motion, City Attorney?
Mayor, Councilmember Troutman, I guess what I would recommend is just move forward with the motion that's on the table, and then if Councilmember Troutman wants to bring a separate motion that this matter be put on an agenda in a certain time frame, he can bring that motion separately.
Okay.
Okay.
So are there other council comments? Councilmember Whalen.
Well, sorry, I guess I was gonna respond to that, but if we're gonna finish the first motion first, we can do that next.
All right, the motion has been made and there is a second. All in favor? The motion has been approved. And now you can go ahead with your amendment.
I guess it would be a new motion. And so I would move that we set on for 6 months from today an agenda item to revisit and reaffirm the state of emergency should we find that necessary, should we need to continue that state of emergency.
Second.
Any council questions or discussions? Councilmember Whalen.
I guess I'm not fully understanding the concern. Is it the concern that it would potentially go on indefinitely, or that if we, because as it stands, it goes on indefinitely, correct? I guess I don't fully understand the need for this, because I would love it. It's becoming less and less certain that this is a possibility, but I would love it if sooner than 6 months we were no longer in this state.
Absolutely.
But I think we're a couple weeks in and just don't really have a way of knowing. So I guess I'm comfortable with it as is, and that we can, as we called this meeting on somewhat short notice to address a emergency situation, I guess I'm certain we could do that again. But so I'd ask for some clarification on why you think this is important.
Sure, and it could just be, it has absolutely nothing to do with the character and the confidence that I have with our mayor and our city manager, and it's not that we would have to keep a state of emergency for 6 months, but it just creates a structural piece that says, because the mayor would control the agenda, and so the mayor would have the authority to bring the agenda item on or not, and so I asked the mayor and I asked our city attorney if there was a mechanism that we could just for residents, so they know that this is not an indefinite emergency. I know our city manager and I know our mayor don't want to have an emergency 1 second more longer than they need to, but it would just create some certainty that we would for sure at least have that conversation 6 months from now.
Councilmember Supple.
Is there any harm in passing this? Can I ask the attorney?
Councilmember Supple, no, as I explained to Councilmember Troutman earlier, this will be in effect until the council takes further action. So I think, at least as I understood Councilmember Troutman's explanation to me, was that he wanted to have a set time for further discussion. I see no harm in doing that. The emergency declaration will stay in place until the city council takes action to end it. So setting a time to discuss it doesn't affect it or negatively affect it, in my opinion.
Thank you. And City Manager Rodriguez, you wanted to say something as well?
Yes, thank you, Mayor. I'm fine with the amendment. But I do want to tell you that the mayor and I have put on our weekly check-in call to reassess the situation. So we are reassessing it weekly to decide if we are going to put it on an agenda to discontinue.
Any other questions or comments? Councilmember Supple.
I would think it would just be a good structure to have in place, just as a procedural thing.
Great. All right, so you made the motion, correct?
Correct.
Councilmember Supple, Troutman. And is there a second?
I already seconded.
Oh, you did?
Yeah.
All right. All in favor?
Aye.
The motion has been approved. Thank you very much, Councilmember Troutman and everybody.
Thank you.
The next item is the city manager's report.
Thank you, Mayor. I'm going to ask Chief Henthorn to provide a brief update on the local impacts of the pandemic and our response. And then I'm going to talk more about our efforts to continue to provide services, keep our employees healthy and safe, and then the financial impact.
Thank you, Madam Mayor and council members. I'll just go through some quick points on some things before I turn it over to our support services manager and public health coordinator, Jennifer Anderson. While we have not seen a public health emergency like this, we are in uncharted territory. We have trained and planned and tested previous emergency plans for H1N1 in 2009 and have participated in emergency planning and execution after 9/11, the 35W bridge collapse, the Republican National Convention, and the Super Bowl. This is classified as a public health emergency, so our emergency pandemic plan is in place and being executed as a public health emergency. These plans prioritize city services that need to be implemented in an emergency situation. They consist of what services we need to continue and or suspend in a pandemic while providing the best services we can during this critical time. We are following Minnesota Department of Health, Centers for Disease Control, and Bloomington Public Health direction during this time. We are also responding quickly and efficiently to Governor Walz's executive orders as they are issued. We are in communication with our mutual aid partners on a daily basis and with Hennepin County Emergency Management. This consists of conference calls and or WebEx calls to communicate vital information and to build surplus of available resources to help each community. Every one of our departments within the city is working collaboratively to help resolve this emergency and mitigate the crisis that is currently facing our nation, our state, and our city. We have information that will be launching tomorrow for our vulnerable population or those people who are shut in. We are having our CERT team members, block captains, and police reserves distribute this information, which will also be in Spanish. We will continually collect information by email and telephone on people that are shut in, and we are asking their neighbors to help out along with us helping out from our department. We have also placed this information on social media, and we'll be looking for that information to be collected shortly so that we can provide those services to those that are in need. I'll have Jennifer Anderson come up and talk about the response more from a public health standpoint.
Good evening, Mayor and council members. I just first want to start out by saying this is a long duration event. We've talked a lot about that in public health on phone calls with other local public health departments, with the Commissioner of Health. And so, I think people are somewhat stunned when they learn that this could be a 12 to 18 month event. certainly not continually on the rise in terms of identifying positive cases, but eventually we'll be on the downside of this, but there could be swells where, again, people are infected. So they're saying, you know, a year to a year and a half before this is really past us. Data and numbers are changing hourly. Today we had 77 positive cases in Minnesota. We have 0 deaths at this point. Nationally, we're at about over 6,500 positive cases with 114 deaths. In terms of managing, as you know, we contract with Bloomington Public Health for public health services, and emergency planning is part of that. And so it's always really nice to be in that Tri-City partnership. We're leaning on Bloomington Public Health for some things jointly. Bloomington Public Health has stood up an incident command center to manage communications, to maintain situation awareness, and to make sure that these 3 cities, in terms of public health steps, information, and process, are consistent. And that's been, I think, really important for residents. And moving forward, it's a big help to Richfield, and I'm sure for Edina as well. You know, I'm hesitant to give too much more information just because it's changing so constantly. I'm on a conference call once a week with the Commissioner of Health. There's a separate information officer call. And so things are changing very rapidly, but I feel like so far we're keeping up well. The questions that are being answered by the city to residents are, they're good questions, they're asking good questions, and we've got solid guidance to provide them based off of MDH and CDC information that's coming to us. Thank you.
Thank you very much. Are there additional comments from staff or updates from staff? Okay, City Manager Rodriguez.
Thank you, Mayor. As Jennifer said, we're really grateful for our unique arrangement with Bloomington Public Health. The city managers from Bloomington and Edina and I have been coordinating at least daily, and we are trying to make sure that we're lockstep or as much as possible, given that we're different cities, in trying to mitigate this. And I can just talk about some of the things that we're doing. We're reassessing daily how to keep providing our services, but also provide that social distancing, and we'll be putting updates up on the website. We have asked all departments to adjust their staff schedules so that they can provide social distancing within their buildings. This will involve some staff working staggered schedules so that they're working in the evenings and weekends. I'm really grateful to all our department directors. They put this together really quickly, and all the staff who are being asked to make changes. Also, I've asked Chris Regis to look at the impacts of this. So far, we won't have the revenue coming in for rec programs. We're going to have some impacts with our DEP register, our passport processing, our driver's license licensing, and the tab work. Our city clerk, Beth Van Hoos, has done a great job being nimble on this. So while we had to suspend our passport work, she's having a drop box for tab work, and she's continuing to be able to do the tab work for the dealership. So we're mitigating those impacts, but we're not having a lot of folks stand in the lobby. So keeping the public safe and keeping our staff safe. We're also looking at, Chris is also looking at that impact for those changes for 1 month, 3 months, and 6 months. As of right now, we have sufficient reserves, and we will see our revenues decline, but nothing that we can't absorb. Finance Director Regis has also asked all department directors to reduce spending where they can, and also to possibly delay projects. So we're looking at each project to make sure that can we delay it, or is it better for us to go forward with those projects. Director Regis is also going to look at the long-term impacts on things like building permits, utility fees, et cetera. So we're broadening that work. But I'm really grateful that the city's in very good financial position. And so we are, that's exactly why you have reserves, is for times like these, so that you can absorb the shock. I also I'm really, really grateful to all our department directors and our staff. They are all working really hard right now and being really flexible. So grateful to them. And I'm also grateful to the council for your support right now. It means a lot to staff, and also your help in communicating with community. So really appreciate your efforts to push our communication out to the community and also bring their concerns back to us.
Thank you, City Manager Rodriguez. Any comments or questions from council members? Councilmember Whalen.
I appreciate all the updates for us and on the internal workings of the city. Would one of the three of you, just for anyone who is watching in, be able to reiterate kind of the top 3 or 5 steps that residents can take and where they can find more information if there are people who have questions that aren't answered yet?
Thanks for the question. It's an important one, and it's a message that public health is working very hard to keep out into the community. So for residents, with schools being closed, restaurants and bars being closed to dine in, we really can't stress enough how important it is for families to stay home, to continue to wash your hands, sneeze in your elbow, use a Kleenex, and to stay home if you're sick. I can't describe how important that message is. Another message, I think, is to check in on your neighbors. A lot of people are home, kids are out of school. A lot of family time it can cause some stress, and so get out. It's okay to be outside. People need to exercise, they need to eat healthy, and they need to check on their neighbors to make sure that everybody's okay. Information about that will be available on our website, our social media sites. People will be directed to a phone number and a staff person that they can call if they need services, if they don't have family, if they don't have anybody on their block that they know. We do run into that occasionally. The police department will be available to help those people who are really, truly shut in and don't have anybody else to lean on. I would say keep checking the social media sites, follow the guidance provided by MDH and CDC around keeping yourself healthy and connecting with your neighbor who may need help.
Thank you. Other council member questions or comments? I would just like to say thank you so much to all of our staff. In one of our briefing meetings just before this, you shared the harder we lean into this right now, the better for our whole city, our whole community, and to let residents know the city of Richfield is absolutely doing that. They are doing exceptional work, working around the clock. Our city staff is doing that. As City Manager Rodriguez said, people are being flexible, staff is being flexible, staff is being innovative and creative in how we can keep our doors open to our residents to continue providing crucial services and maintaining safety and protecting the public health. We are increasing our cleaning. We have dramatically increased our cleaning to ensure that as we stay open, folks, our spaces are safe, our public spaces are safe. So I just want to say thank you so much to all of our staff from our core team, leading the work, working around the clock, basically going home to sleep and then come back and do this again. To our department heads who are looking at creative ways to save money, to our on the ground staff who were leveraging their skills of Spanish speaking, of community outreach, of community knowledge, and stepping in as needed, and providing those creative solutions and really protecting our residents. I wanted to reiterate again, we are extremely lucky as well in the city of Richfield to be served by a municipal level public health department. We are only one of 2 municipal level health departments in the entire state of Minnesota. There's Minneapolis Public Health, and then there's Bloomington, Edina, and Richfield. We are very fortunate, and in this crisis, that is helping our residents in our region. So thank you to the work and the efforts of Bloomington Public Health, and to the partnership that we have, that close partnership as our staff shared in our City Manager Rodriguez. We are in lockstep with our partners at Bloomington and Edina as well at the city level. I want to reiterate again the exceptional work that our staff is doing with our Black captains, deploying our Black captains, our police reserves, and then our CERT team to all of the households across the city of Richfield to ensure that we're not just putting information out online, but that we're also getting communications out, bilingual communications to the residents of Richfield, to ensure that they have the information that they need to stay safe, that if they think or feel or know that they are a vulnerable resident, or they know that they have vulnerable neighbors, that our police department is able to check in on them and make sure that they have what they need, and they're connected to the right resources and supplies. That is a huge resource to all of our residents, is the work that we'll be seeing with our Black Captains Reserves and CERT team. So thank you so much for taking that decision. And again, I know this was all shared, but these are just a couple things I really want to reiterate for our residents that are happening, and thank our staff for that. And then we have our front lines emergency folks and our staff, our police, our fire, our healthcare workers, and others who are really, working on this and putting their personal health and their lives at risk in the process. We thank them for their continued commitment and their work to protecting the health and safety of all of our residents. And I'm sure there's so many folks that I'm missing, but I just want to take the time to say thank you over and over again to all of our staff. Thank you to Neil, who is our communications manager, who is doing outstanding work in ensuring, and not, in partnership with others across the city, to make sure that we have the most up-to-date information. I've been receiving accolades on our communications and outreach from other cities. We are one of the few cities I am seeing, unfortunately, that is putting information out in Spanish and in other languages. So community members from other cities are looking to our websites and our information to post, because unfortunately in their communities they're not having that. So thank you to Neil and his work on communications. And then as we know, our city staff is working around the clock to protect our residents, but we also have I spoke to a resident owner here today in Richfield and other business owners who are having to lay staff off, childcare providers and workers who are having difficulty in taking care of their kids and taking care of their vulnerable family members. And the blow that this is having across our community is huge. And I am seeing folks in our school districts, in our other schools, in our private and charter schools coming together, our nonprofit organizations, our faith-based organizations stepping up in real concrete ways to donate, to volunteer, and to support the health and well-being of our whole city, of our whole state, and of our entire country. So thank you to everybody, and continue to ask and reiterate the messages that we're hearing. Please make sure that you are taking care of your individual health and protecting yourself, and then encouraging those around you. Make sure you're checking in with your neighbors, your family members, identifying vulnerable folks. Call all of your council members. That will be going out. There's a message from the city council that will be coming out soon. Or is it out already, Neil? I can't remember what you said. From the city council, the message? Okay. So there's a message online, and it will be posted on our website, and we will be make sure to share it in other ways. From the city council, we want to reiterate that we all are here to be a resource to all of our residents. If you have questions, comments, or concerns, we've put our phone numbers and our email addresses up. And again, we are just asking our residents to please contribute as a whole community and do everything that you can and you're able to protect our neighbors in this pandemic. So I'm sorry for being a little long-winded, but what we have been seeing is unprecedented, and also the heroic leadership from our staff and from our residents is tremendous and amazing, and deserves accolades. So thank you to everybody who's been leading through this. Any last items? All right. Well, with that, I will adjourn our meeting. Thank you.